For decades when you think psychedelics, you think the trip, right? But what if I told you the most powerful healing part of these compounds has nothing to do with hallucinations at all? Yeah, it turns out science is uncovering this secret action that could literally change everything we know about treating mental health.
I mean, think about it. Traditional antidepressants, they can take weeks, even months to kick in. But with things like LSD or psilocybin, we're seeing these incredibly fast and long-lasting therapeutic effects, sometimes from just a single dose. It's no wonder this has sparked a total renaissance in psychedelic research.
Okay, but there's always been a huge catch, right? The very thing they're famous for, that intense psychedelic trip, makes them a real headache for clinical use. You need heavy medical supervision, there are safety concerns, it's just not practical for everyone.
So that leads to the million-dollar question for scientists. Can we somehow separate the good stuff, the therapeutic benefit, from the trip? Can you get the healing without the hallucinating? Well, guess what? A groundbreaking news study says, yeah, we just might be able to.
To figure this puzzle out, researchers had to think outside the box. For the longest time, everyone pointed to one thing, the serotonin 2A receptor. That was supposed to be the source of all the effects. But this team, they started looking for a different target entirely.
And that's what led them here, to a molecule called the TrkB receptor. Now, TrkB is a huge deal when it comes to neuroplasticity. That's just the brain's incredible ability to physically rewire itself. And as it turns out, this little receptor is the unexpected hero of our whole story. Okay, so check this out. This is the first major clue they found. What you're looking at is a graph that basically measures how sticky LSD is to these TrkB receptors. See that really steep blue curve on the left? That's for the normal version of the receptor. The steeper the curve, the tighter the bond. And folks, that is a very tight bond. We're talking about a molecular attraction way stronger than anyone saw coming.
And just how strong are we talking? Get this. The researchers discovered that LSD binds to this TrkB receptor up to 1,000 times more tightly than traditional antidepressants like fluoxetine. 1,000. This wasn't some minor accidental interaction. No way. This was a primary target. So you can imagine, this discovery completely changed the game. It shifted the entire focus. The new question became, if LSD is grabbing onto TrkB that tightly, what exactly is it doing to the receptor on a molecular level? All right, let's zoom in and get our bearings here. What you're looking at is the TrkB receptor itself. See how it kind of sits across the cell membrane? The top part is sticking outside the cell, waiting for a signal, and the bottom part is on the inside. And right there, nestled deep inside that middle section, that's our binding spot. That's where LSD docks. Okay, now this is where it gets really cool. Here we're comparing how two different drugs interact with the exact same receptor. On the left, you've got LSD in purple docking with TrkB. And on the right, in yellow, that's a traditional antidepressant. See? They both connect, but they're grabbing on in totally different spots. And that difference is everything.
Let's break that down a bit. You can think of it like a molecular handshake. LSD, in purple, comes in and forces the receptor into this really tight, compact shape. But the traditional antidepressant, in yellow, holds it in a much more open and relaxed position. It might seem like a super tiny atomic level difference, but believe me, that change in shape completely alters the signal that receptor sends out to the rest of the brain cell. It's a huge deal.
So getting down to this precise atomic level of detail showed something incredible. It's not just that psychedelics hit the same target as antidepressants. Nope, they're hitting it in a totally different and way more powerful way. Which leads to the big question, what does this unique hand shape actually do inside the brain?
Well, it all comes down to one crucial concept, neuroplasticity. Simply put, this is your brain's amazing ability to rewire itself. It's the physical process behind learning, making memories, and, this is the key part, recovering from things like depression. It's literally your brain growing and strengthening its own connections.
And this? Wow, this is what that looks like. This image is incredible. It shows you what happens to brain cells, to neurons, after they've been treated with a psychedelic. All those tiny little branches you see? Those are brand new connections, new pathways for information. The brain isn't just sending different signals. It is physically rebuilding itself, sprouting this dense forest of new connections. It's literally rewiring in real time.
But wait, how do we know for sure that the TrkB receptor is the one responsible? Well, this chart is basically the smoking gun. In normal mice, you give them LSD, and boom, you see a huge spike in that new growth. But look at the second bar. In mice where they mutated the TrkB receptor, so LSD couldn't latch on, nothing. Absolutely no effect. The rewiring just doesn't happen without that specific molecular handshake.
I mean, the study itself says it perfectly. This entire brain rewiring effect, this neuroplasticity, it absolutely depends on that unique handshake with the TrkB receptor. And, this is so important, it has nothing to do with the 5-HT2A receptor. You know, the one everyone thought was responsible for everything, including the trip.
Okay, so let's recap. We figured out that the therapeutic brain rewiring part comes from the TrkB receptor. That's locked in. And that leads us to the final and most important piece of this whole puzzle.
So if TrkB drives the therapy, what drives the trip, right? I mean, where do the hallucinations actually come from? Is it possible that the two effects are truly separate things?
And the answer, it turns out, is a surprisingly clear yes. We're looking at two completely separate pathways. It's as simple as this. The antidepressant effects, the brain rewiring, that's all driven by the TrkB receptor. The hallucinogenic effects, the trip, that's driven by the classic 5-HT2A receptor. They aren't tied together at all. They're two different events happening at the same time.
And here's how they proved it, the final nail in the coffin. In lab mice, there's this behavior called a head twitch that's a super reliable proxy for a hallucinogenic effect in humans. So they gave LSD to mice that had the broken TrkB receptor. And guess what? The mice still had the head twitches. But then, when they gave the mice a different drug to block the 5-HT2A receptor, the twitches stopped completely. That was it. Definitive proof. The trip has nothing to do with TrkB.
And just like that, everything clicked into place. This is the breakthrough, the solution to the puzzle we started with.
And the implication here is, well, it's absolutely massive. Because now that we know the exact molecular handshake that triggers all that brain growth, we can start designing new drugs that do only that one thing. We can create molecules that are precision engineered to hit the TrkB receptor and kickstart that rewiring process while totally ignoring the 5-HT2A receptor that causes the trip.
Just as the scientists who did this research conclude, this could open the door to a whole new class of antidepressants. Imagine drugs that have all the rapid, powerful, and lasting benefits of psychedelics, but without the trip. Something that's finally safe and practical enough for widespread clinical use.
So is the future of mental health treatment a pill that can actually rewire your brain, but without the psychedelic trip? Based on this research, the answer seems to be a resounding yes. We really might be on the verge of a brand new era in medicine, one where we can tap into the brain's own incredible ability to heal itself, offering real hope to millions. All of the benefit without the trip.